pharmacare. It is now law in this country, which means Canadians could soon get contraceptives and diabetes at no cost to them. First, Ottawa needs to get deals done with provinces and territories. Earlier, I spoke to NDP House Leader Peter Julian. Peter Julian, thank you so much for joining us.
My pleasure.
So pharmacare has now gotten royal assent, made its way through the Senate and is law. The next step, though, is for the federal government to make deals with the provinces. And as I'm sure you know, there are some provinces who have already said they're not interested. Alberta, Quebec has its own program. How difficult do you think it will be to get these deals done with the provinces?
Well, first off, this is really October 10th, 2024 is a historic event, I think, for Canadians, that we're finally moving forward 60 years after universal health care to move towards universal pharmacare. And we're the only country that has universal health care and doesn't have universal pharmacare. So for various reasons, there's cause for celebration. I think it's fair to say for the people with diabetes that are paying $1,000 a month for their medication and devices, it is absolutely essential that the government now sit down with the provinces. I know Mark Holland, the health minister, understands this. Yeah. Sit down with the provinces and sign those agreements so that people can actually get the benefits of pharmacare and have that incredible burden of $1,000 or $1,500 a month lifted off them so that they can take the medication that keeps them in good health.
They have an MOU, as you know, with your province, with British Columbia, but haven't really started with the others, and of course couldn't have agreements until it became law. I wonder how urgent you think this is because of the political context that we're in, the fact that there could be an election at any time.
I think it's urgent because of how people are suffering. I mean, the Canadian Federation of Nurses Unions estimates that we lose 200 to 300 Canadians every year because they're not able to pay for their diabetes medication and devices. I mean, it is literally saving lives to sign these agreements and to make sure that this medication is available. Contraception, also very, very important. And so I think what we would expect, and Jagmeet Singh spoke to this in his scrum after the announcement of pharmacare passing, it's the Liberal government now has to step up and start signing those agreements with provinces. We saw with universal health care, it did take some time. Took a couple of years before provinces signed on, all provinces. But the reality is Canadians, and there are nearly 6 million Canadians who suffer from diabetes, they are looking to have put into place a program that actually saves their lives and makes sure that they can have a good quality of life and they can actually have the medication that their doctors prescribe that is so important for them. So I would expect there's going to be a lot of pressure on provinces. If the federal government is acting promptly, to sign up and make sure that the people in their provinces are covered.
Would you like to see deals reached before you're even willing to contemplate bringing down the government? Because, I mean, as we both know, the Conservatives aren't really interested in this program. But sometimes when programs are in place, it becomes harder to take them away from Canadians. So would you hope that some deals could be done before you at least consider forcing the government's hand for an election?
Well, as you know, we're proceeding vote by vote like we did during COVID. So I'm not going to make any predictions about.
No, but would that be a factor? Would that be a factor, I guess, is what I'm thinking.
What we want to make sure is that we keep making improvements in people's lives. That's how we proceed vote by vote. And if we think we're making progress, that's one door. And if we're not making progress, that's another door. But the reality is, there is no reason not to sign these agreements and to start to get the medication flowing immediately. It is literally life or death. When you think of the cost to our acute care system of people who can't afford their medication, then being in the hospital, getting their medication free while they're in the hospital, and then being forced to find $1,000 or $1,500 a month for their medication afterwards. It's a crazy situation. It should have been resolved years ago. We're glad that the Liberals accepted Jagmeet Singh's leadership, and we now have this in place. But it's vitally important now that we get these agreements so that people can actually benefit from the program.
So in BC, as you know, the contraception, I believe, I don't know if it's all kinds, but is free. In Manitoba, it's the same. Would you think that the government would be open to saying, well, here's the amount of money and you can make a different drug universal if you already are paying for it provincially? Is that something that you think should be on the table as a negotiating point?
I think the reality is the federal government has the ability to sign these agreements, to negotiate agreements that provide for diabetes medication advices and contraception. I don't see any impediments to that. If the federal government is acting in good faith, and Jagmeet Singh did call on the Prime Minister to move promptly to sign agreements with provinces, I think only a handful of provinces might not want to sign purely for ideological reasons, not because they don't understand the benefits to people. And you mentioned Quebec, Rosemary. I think that's very important. That during the debate on this pharmacare bill, that one of the largest coalitions in Quebec history, all of the central union centrals, the consumer groups, healthcare professionals called on the Quebec government to support, and called on Quebec members of parliament to support the NDP's pharmacare plan. And so even in Quebec, there is a strong public support for this.
That's because
for this initiative.
Quebec has a drug program already,
with massive holes.
Yeah, okay, yeah.
With massive holes. It's not universal single payer. That's why the coalition came together. It's 1.5 million Quebecers. Has enormous influence. And the other thing I want to mention is dental care. We've had 750,000 Canadians that have already benefited in the first 22 weeks from the NDP's dental care plan. And what I'm hearing on the streets here is people saying, I've never voted NDP before. Some of them are seniors and they've always voted Conservative, but they're saying, I want to make sure the dental plan is in place and continues. And so Pierre Poilievre is going to have, I think, a question put to him constantly, because he's indicated he wants to eradicate all these programs. And the reality is Canadians, I think, are warming to them. Certainly dental care has been a clear success, one of the most successful new federal programs in decades.
One of the things that Mr. Poilievre says about the pharmacare, as you know, is that it would actually result in Canadians losing private coverage, because companies would see, okay, well, the federal government's going to pay for diabetes, so we're going to just take that off our coverage plan. Do you see any reality where that it does in fact happen?
I think Pierre Poilievre says a lot of false things. He said that the dental care program didn't exist. He's saying pharmacare doesn't exist. I mean, he said a lot of things.
Well, it doesn't exist right now. It's not being delivered. It might exist, but it's not happening.
But he said that. He said that about dental care. He was wrong. Sure. I expect he is wrong on pharmacare as well. And the reality is, how do Conservatives defend their position of eradicating all of these programs when so many people are benefiting? Okay.
Peter Julian, nice of you to make the time, sir. Thanks.
Thank you.
My next guest is a Canadian who might be able to take advantage of this new pharmacare program if they get deals with provinces. Roger Cook is living with diabetes. Roger, thanks for joining me this morning.
Thank you for having me.
So what would free diabetes medication mean for you and for your family, Roger?
Well, if we were able to have this program in place with my family directly, we'd be able to redirect the expense, which is essential for my health, into something such as an education fund with my daughter. And, with the cost of living the way it is now, there are other things that we would be able to maybe introduce into our life, whereas we haven't been able to because of the expenses that I have with my diabetes. But my education with my daughter would be a big help.
The diabetes medications are so expensive. You have some insurance through your employer. What do you have to pay, though, yourself? Because it doesn't cover everything.
Well, I said with the plan that I have, the plan that we have, there's a certain percentage. And after your taxes and everything, I'm paying about $250 out of my pocket. And I'm very fortunate that I have that plan to at least cover a lot of that.
Sure. Is that a month, Roger, you're paying that?
Yes, that's correct. That is a month, yes.
Wow, that's a lot. So would you want either this plan to pick up all the coverage of your diabetes medication or just that piece that you have left?
Well, me personally, I would prefer if it could cover it all, but I want what's best for everybody. And, some people don't have plans, so it'd be nice if it would cover for them all. I'm lucky I have a plan that covers something, so.
Yeah, so as you know, they have to make deals with the provinces. You're in New Brunswick. You're in the midst of a provincial election there, so we'll see who wins and how that goes. But do you think that it's important for provinces to be open to signing these deals with Ottawa?
Yes, very much. As you know, it's it's across the country. 3.7 million people are directly affected here with diabetes. So I am hoping that all the provinces buy in. There's a lot stronger buying power if everybody buys in.
What would you say to people who might not understand how costly diabetes is and the diabetes medication, and Roger, if you don't get it treated properly, the consequences of that in terms of health?
Well, I've done some research on it, and as diabetes progresses, if you don't manage it, and that's the thing, you've got to manage it. You've got to have your diet, but the diabetes, insulin, and the pills that people are on, if you don't, it only gets worse. And once it gets worse, they become hospitalized. They need care at home, and the costs then are a lot more than what it is if you can maintain it yourself and manage it.
Sure. Roger, thank you for making the time to talk to us this morning. I hope you've got some turkey on the menu later.
Yes, we do. And I hope the same. Thank you very much. It's been a pleasure speaking with you.
All right. You too, Roger Cook. Thank you so much. Happy Thanksgiving, sir.